2007, I was sitting in a red light. Somebody hit me from behind so hard that I could not open my driver's side door. From that day forward, I had neck and shoulder pain pretty regular. I dealt with it for a few years until it got to the point to where I couldn't turn my head, or every night I was having to lay on a heating pad and whatnot. And I came back to Dr. Chaudhry. Dr. Chaudhry has been awesome. He has dealt with me coming in tears and what do I do? I can't. The neck and shoulder actually got better from the bone removal, but the arm is constant pain, nerve pain, burning, tingling, constant inside, and I can't use my arm. He was really awesome. I have children and I work full time, and I need something that can get me through the day without having to rely on medication. So he suggested an electrical stimulator. He was very helpful in giving me all the information I needed. Was working with his office because I do have an out-of-pocket with insurance now. Worked with his office to get it all set up. When I got the surgery performed, and it has been night and day. And I have been ecstatic. I really have. My energy level has gone up. I'm not hurting all day long, and if I do start hurting, there's a remote. I can turn up the I can turn the strength of the electrical stimulation that's going to my arm and turn it up, and then I can turn it back down. I mean, it just depends on how much pain I'm in at that moment. I would say get it done. I did procrastinate. I probably went a year longer than I had to without getting it done. And I was afraid, well, what if it doesn't work? And this is my spine. It's a major surgery. And Dr. Chaudhry was really good about talking me through that. But yeah, I wish I had done it earlier. I really do. It really has helped. It really has helped, and it's helped me to become a stronger, better person. And I just really appreciate Dr. Chaudhry for taking the time to tell me about it, to make sure I had all the information, to help me, work with my insurance, to get everything that I needed to get done. And it just, definitely don't put it off.
So one of my favorite procedures to do in patients to treat is neuromodulation, or better known as spinal cord stimulation. Typically these are going to be patients that have had previous neck or back surgeries that haven't had a good outcome. They come to me oftentimes at the end resort. They haven't gotten better doing anything, and a lot of times they're taking a lot of narcotics or pain medication. Their life is miserable, their family's frustrated with them, and they've almost gotten to a point where they've given up hope. It's an outpatient procedure. It's a little bit more invasive than some of the other procedures I do. It essentially entails I go in still with a needle, a little larger needle, and I thread a catheter. It's an electrical lead up by the spinal cord. And what it does is it replaces where patients are having that excruciating pain, typically in the low back and legs, or in the neck and into the arm, with a more massaging, relaxing feeling. And what it really does is it allows patients to get their functionality back, and to see that positive response when they come back to me, and to see their families just talk about how much better they're doing. There's nothing more gratifying than that, and that's really why I went into the field of medicine. And so not only from a technical standpoint is it one of my favorite procedures to do, but also from an outcome standpoint, it's probably one of my most enjoyable cases that I do.